The nation's top health experts are offering a stern new warning ahead of New Year's celebrations. Joining us now to get some clarity on the situation is Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor Dr. John Brownstein. Dr. Brownstein, so much to unpack here. So first things first, the CDC has just announced that it will shorten the recommended time for isolation from 10 days for people with COVID-19 to 5 days if they are asymptomatic. Now that, of course, would be followed by 5 days of wearing a mask when around others. But what kind of science is behind this decision, and why are we seeing this change right now?
Well, good evening, Rachel. I think this is really important and timely. As we accumulate more data about infectiousness and transmission, it's important that we keep up with the science and update guidance. You know, the 10-day isolation is a lot to ask of people, and especially if you're trying to get people to adhere to these protocols, we need to make sure that they're based on science. And as we know now, you know, symptoms occur within 1 to 2 days of being infected. You know, at that point, you're contagious. You know, that contagiousness period can take about 3 to 5 days. So, you know, you're not really contagious beyond that. So it was important for CDC to keep up with that, especially with Omicron. Super important that, you know, people adhere to this. And it's really important to get people out of isolation. We saw that with our healthcare workers, but now more broadly to get people back to work. This is going to be important in the next few weeks.
Yeah, the CDC director has always made it clear that they will follow the science. It seems like everyone at this point knows someone who has tested positive for COVID-19. Do you agree with Dr. Fauci that things will get worse before they get better?
You know, I think, unfortunately, that's true. If you look at where we're at in terms of a surge in cases, we're beyond where we were at with the Delta variant. Now, it's great news that this variant is likely less severe, but the sheer amount of transmission that's occurring over this holiday period means that we're going to see an increase in hospitalizations. We're already seeing EDs packed. It's a matter of time before we see that increase in hospitalizations. But I do think there, you know, is a light at the end of the tunnel. If you look at other countries where this wave has gone pretty quickly, that's the hope that we will have in the next few weeks. We don't know yet, but you know, we just need to get through these next few weeks with people just helping to reduce transmission in the community through vaccination, boosters, masking, and limited mobility.
We are also seeing pediatric hospitalizations levels rise in the United States. They're surging to the highest point since the early fall. So for all the parents out there, what should they be on the lookout to protect their children?
You know, this is a real concerning trend. It's not because necessarily Omicron is more severe in kids. It's just that our kids remain unvaccinated for the most part. You know, we're only seeing about a third of kids under 18 vaccinated. Kids obviously under 5 are yet to get that immunity that their adults have gotten. So this is why kids remain at risk. And this is why it's important for the adults and those eligible around them to get vaccinated, to get boosted, to mask, to make sure you're not exposing kids in large crowded settings. You know, keep doing what we've been doing throughout the pandemic, but recognize that there's just so much more transmission in the community. So we sort of have to double down on all these measures to keep our kids safe.
And people nationwide gathered to celebrate the holidays when we were already seeing a large increase in cases. We saw those images of busy airports. So if you find out that you were in close contact with someone who tested positive for COVID-19, what should you do now? And how does that answer differ for people who are vaccinated versus people who are not vaccinated?
Well, actually, these guidelines just changed in a matter of hours ago for quarantine. And the CDC essentially has lumped in people that are unvaccinated with people that are 6 months out from their vaccination and haven't gotten a booster. The recommendation is 5 days of quarantine followed by 5 days of masking. If you are vaccinated and boosted, that is different, and you can actually not enter quarantine. But the recommendation is to do 10 days of masking and get that test, because it's so important to identify whether you're infected. So at day 5, try to get that test, identify whether you're infected. Either way, if you're symptomatic, you should enter quarantine and try to get testing, because of course there's so much transmission in the community that if you do develop those symptoms, it is very likely to be Omicron.
Important advice there, and I want to get to the testing. The shortage of testing is a major issue in the country right now. We're seeing empty shelves, long lines. What is your reaction to this, and what is your advice to Americans who are trying to find a test and just cannot get one?
This is a real travesty. I mean, we should have been better prepared. We knew that testing was the key to getting out of this pandemic, and now it's become a bottleneck once again. Testing is key to identifying infections and limiting transmission in the community. So we're back to it again. The reality is people should try to see if they can find testing in the community or use those at-home rapid tests. Those are super key because they can identify whether you're contagious. But at the end of the day, if you do have symptoms and you can't get tested, just assume that you're positive because infections are so rampant, and go into that protocol of quarantine if you do have those symptoms, and eventually you'll get that test. But we can assume that you can wait and get a test result in a few days, because by that time you may have transmitted the virus and sort of enabled chains of transmission. I know this is so frustrating for so many people. Help is on the way in January with free tests coming, but until then, we just have to do what we can to limit transmission among our households and in the community.
And the Biden administration announcing that they will be making 500 million at-home test kits available in January, but unfortunately too late for the holiday season. Dr. Brownstein, we appreciate it so much for walking us through all of that. Thank you.
Thank you, Rachel.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.